So let's go over this so that you kind of know what I'm talking about here. I'm going to go over the outer structures first, and then I'm going to go on the inner structures. So the outer structures are the same structures that you would identify on the pig heart or on the sheep heart, but I'm going to show you now on the cow heart, okay? Again, one of the things you have to do is figure out the front from the back and which one is which. So one of the things that you look for instance, is this large structure right here, which is the pulmonary trunk. Typically, the pulmonary trunk is always visible on the front. If we flip it over, you'll see that the pulmonary trunk kind of disappears behind all this other stuff, and you can still see the aorta. So the aorta is visible on both sides, both the front and the back. So we know that this must be the aorta. So we flip it back over here, we know that this is the front. Okay? So here we have the pulmonary trunk, and here's the aorta. Now, we have the front. This tells us one thing. One, because this is the front, this auricle right here, and this atrium that's behind it, that's the left auricle and atrium. If we turn it and we go to the other side on the back, we'll see that we have the right auricle and atrium on the back. Okay? Now, because we're able to now identify the left and the right auricle, we're now able to identify the structures that lead into the auricle. So the right atrium has blood coming into it from the superior and inferior vena cava. So we know that there should be a structure running into this that is carrying blood from the superior and inferior vena cava. So sure enough, we can see that there's a hole right here. This hole, I can follow it, and sure enough, my finger goes right inside, and I'm moving the atrium. That tells me that this has to be the vena cava. This happens to be the superior vena cava, which means then if I turn the other direction, and I take my finger and I go downward, I should be able to find another opening, which I do, and sure enough, there's the inferior vena cava. So you can see they're very close to each other, okay? Not like the picture or the model, where it makes it seem like here's the superior and here's the inferior down here, as if separate structures. They're not. They're not. That's what I was telling you when we were going over this in class last week. Now, next to the inferior vena cava is this large opening here, which should have been the blood vessels that were leading into the left atrium. Unfortunately, when they cut this out of the cow, they ended up cutting the blood vessels, and so now we just have a large opening here. Okay? So that's unfortunate. Now, I'm going to flip this back over here. We can see that there's a blood vessel that comes down here, right there. And then there's another one that comes down right here. These separate the two ventricles. There's a ventricle here and there's a ventricle here. This one happens to be the posterior interventricular artery / middle cardiac vein, whereas this one is the anterior interventricular artery / great cardiac vein. I would prefer great cardiac vein and middle cardiac vein than the anterior and posterior interventricular artery. Typically, veins are closer to the surface, so you'll see those better than you should see the arteries. But let's flip this back over. And then up here, in this area right here, the coronary sinus. Okay? Y'all look good so far? Mm-hmm. All right. Now,
Posterior view. Is that the back?
This is the posterior view.
Yeah. And where's the sinus again?
Oh, right there.
Oh, okay. It's like that.
Okay. Now, if we look at the aorta here, you'll see that the aorta comes out, but there's a blood vessel right here that comes out of the aorta. This is the brachiocephalic artery right there, so that's what that is, okay? Y'all good so far? Okay, the tip of the heart, of course, is the apex. I don't think that I have to explain that. All right, y'all look good on that? All right, so I'm going to flip it over like that. Okay, so now we can actually see the inside of the heart. Notice the difference in the amount of muscle mass on the sides of the walls of the ventricles. Notice that this one's much larger than this one over here. This tells us the difference between the left and right ventricles. The left ventricle has more muscle mass than the right ventricle. So this is the left ventricle, this is the right ventricle. Okay? Y'all good so far?
Yes.
Now, this structure right here that separates the two ventricles is the interventricular septum. Okay? All of this is actually myocardium. But since this is actually a specific structure, I want you to tell me that this is the interventricular septum. Okay? If I pin here or here, I want myocardium. Okay? So be very careful of it. Now, you'll see once we look inside the ventricle, there's a large muscle mass right here. Can't miss it. It's just obvious. This, of course, is a papillary muscle. There are several papillary muscles. There's another